For decades, measles was basically a ghost, a disease we'd conquered in one of the greatest public health victories in history. But now, that ghost is back, and it's haunting communities all across the country. Okay, let's dive in and figure out how a threat we all thought was long gone is making such a dangerous comeback. Let's just start with a number. 1,596. As of October 2025, that's how many confirmed measles cases have been reported in the United States. Now, I know, in a country of over 300 million people, that might not sound like a huge number. But for a disease that was officially declared eliminated, yeah, that's a massive alarm bell ringing loud and clear. And just to put that into perspective for you, this is the highest number of cases we've seen in more than 3 decades. You'd have to go all the way back to the early 1990s, before we'd even eliminated measles, to see numbers like this. So this isn't some small blip on the radar, this is a historic resurgence. And this is not just 1 or 2 little hotspots. I mean, just look at this map from the CDC for 2025. The problem is widespread. We're seeing outbreaks pop up everywhere, from the West Coast to the East Coast. This has grown into a full-blown national crisis. So that brings us to the big question, right? How on earth did we get here? Let's take a look at the reemergence of a disease that, for all practical purposes, we had already beaten. I think for a lot of people, the first question is, why are we so worried? Many of us grew up thinking of measles as just some harmless childhood rash. But the stakes here are incredibly high. And that's because, and I really can't stress this enough, this is so much more than just a rash. The reality of what measles can do is way more dangerous than its reputation suggests. This is not about a fever and a few spots. For anyone who isn't vaccinated, 1 out of every 5 people who get it will end up in the hospital. For children, it's even scarier. 1 in 1,000 can suffer from brain swelling, which can cause permanent brain damage. And, just tragically, as many as 3 in 1,000 children can die. In fact, in 2025, 3 deaths have already been confirmed here in the US. So if measles is that dangerous, how did we manage to control it so well for so long? Let's take a step back and look at how this incredible public health shield was first built. This is the question that's probably on your mind because it's on mine too. We were told this was a solved problem, that it was a thing of the past. And you know what? For a really long time, it was. And this chart just illustrates that success perfectly. It's incredible. Look at the numbers before the vaccine was introduced back in 1963. We're talking hundreds of thousands of cases a year. And then, look what happens. The numbers just plummet. It's one of the most powerful public health stories ever told, right here in one picture. This incredible success led to a huge milestone in the year 2000, elimination. Now, it's really important to understand what that word means. It doesn't mean 0 cases ever. It just means the disease is no longer constantly spreading on its own within the country. Any cases we saw were typically from travelers. This is the victory that is now in serious jeopardy. Okay, so if the shield was so strong and so effective, what happened? Where did the cracks start to appear? The whole system, that entire shield, really rests on one critical number, 95%. That's the magic number you need to hit for vaccination coverage to protect an entire community. And that brings us to this idea of community immunity, which you might also hear called herd immunity. When you get to that 95% mark, there are so few people left who can get sick that the virus just fizzles out. It can't find anyone to infect. This protects everybody, but especially the most vulnerable among us, like babies who are too young for the vaccine or people with weakened immune systems. But here's the problem. This chart of vaccination rates for kids entering kindergarten tells the whole story. Back in 2019, we were just barely above that magic 95% line. But fast forward to the last school year, and our national average has dropped to 92.7%. For the first time in a long, long time, our national shield has fallen below that critical level needed to stop outbreaks. And this isn't just an abstract number. This quote from a health director down in Austin, Texas, really shows you the reality on the ground. The pandemic just messed everything up, including routine checkups for kids, and it's been a real struggle to get families caught up. So why is this happening? Well, it's really a perfect storm of factors. The pandemic threw routine healthcare into total chaos. It's gotten harder for some families to find low-cost vaccines. As we've seen in places like Texas, school districts are under a lot of pressure and sometimes struggle to enforce the rules. And, of course, the general politicization of vaccines that exploded during COVID has unfortunately cast a long shadow over all childhood immunizations. When you put all of that together, it leads us to the final and most critical question. Given all these cracks in our shield, what is the actual risk we're facing today? Well, researchers at Johns Hopkins actually created a framework to help us understand the risk. They laid out a few different scenarios, from the best case, where you just have a few sporadic cases, all the way to the worst case, where we could actually lose our elimination status. So the question is, where are we on that scale right now? And here's the answer. We are currently in scenario 3. That means we have moved way past small, isolated flare-ups. Right now, the United States is officially dealing with large, sustained outbreaks of 50 or more cases. We are no longer in a low-risk situation. So we end here. A disease that we beat, a disease we put in the history books, is back. It's finding and exploiting the vulnerabilities that we've allowed to grow in our public health defenses. And it leaves us all with a fundamental question to think about. What does it really take to protect a public health victory once it's been won? And are we still willing to do it?